So this video is going to cover the pros and cons I experienced with the switch from Ocrevus to Kesimpta, and also what I'm considering moving forward. Hi everyone, I'm Cliff and I have MS. But first, before we get started, here's a fun little fact. Germany has the highest rate of diagnosed multiple sclerosis in the world. People really don't know why yet, though it could have something to do with their pretzels. Most importantly here, I'm not a doctor, I'm not a clinician. Talk to your doctor about all this stuff. This is just my experience and my perspective. If you are recently diagnosed and your doctor has said it's time to make a decision about which drug to take, even though this video is about someone who's been on both drugs for almost 5 years, I think it's gonna have a lot of valuable information for you, because looking back, I would have done things a little bit differently when I started my drug regimen for multiple sclerosis, and we'll talk about that. So first off, what's the difference between Ocrevus and Kesimpta? Well, there are a lot of differences. I think the biggest difference is the delivery mechanism. So with Ocrevus, you go into a clinic every 6 months and sit there in an infusion chair. They plug you into an IV, you have a clinical staff there, and you sit there from 4 to 6 to 7 hours while this stuff drips into your system. With Kesimpta, it's basically a home injection. And if you get queasy at the thought of doing your own injections, keep listening, because I really battled with that, and I'll talk about that later. If you want to get kind of nerdy with the science behind this, basically these two drugs block a CD20 protein. Here's a nice little illustration on a scientific front that Dr. Feehan allowed me to use. Thank you, doctor. Both are CD monoclonal antibodies, meaning they target and deplete B cells in the immune system, thought to contribute to MS. They do this in slightly different ways, but the end goal is to target the CD20 protein, bind to it, and render it basically ineffective. Okay, so the administration of the drug is, for me, was 7 hours with Ocrevus every 6 months, and it's about 5 seconds with Kesimpta every month. So I started on Ocrevus in 2018, and what eventually ended up happening is after 2 years, I switched to Kesimpta because Ocrevus was not working for me. And what do I mean by Ocrevus not working for me? Well, it was working for me in stopping the progression of disease. But all was not well in Ocrevus land, and I'm going to talk about the cons of my experience with Ocrevus. First of all, the lengthy IV administration. I don't like sitting anywhere for 6 hours, I'm just not comfortable sitting down, so that was not okay with me. Also, I just don't like needles and IVs. The prophylactic drug cocktail, which consisted of Benadryl and Tylenol and Zofran for the nausea, plus 2 other things, I don't remember what they were, I think caused a lot of the side effects the next day. I mean, you're unloading a lot of crap in your system in one day. The crap gap. The crap gap is basically, there's this time that after you get your infusion where things seem to be going swimmingly well, and then it falls off, and you have to wait until your next infusion for those things to resolve. So what I mean is, my symptoms would really be reduced during that first 3 months. Remember, this is a 6-month infusion. Like, you take it and then you wait 6 months for the next one. The first 3 months were good. The last 3 months were terrible. Everything came back, and it was just miserable. This became a constant. I could set my watch to it, and it's one of the main reasons I started looking at other drugs. The side effects were pretty gnarly. 3 or 4 days after the infusions, I just felt crappy. And like I said, you're putting a lot of drugs in your body in one day. The clinical scheduling may have changed, but back in 2018, 2019, of course, COVID started, and getting into a clinic was just a hassle. And it just added another step to the process of something I didn't want to do to begin with. All right, let's talk about the pros of Ocrevus. Okay, it definitely helped with the symptoms for the first 3 months of the infusion. It definitely reduced relapses. It definitely reduced progression, according to my MRIs. And the clinics had yummy snacks and cozy lounge chairs. So, I mean, the drug was effective. I just don't know if it was effective in reducing symptoms, but they never promised that. They said they were reducing progression and reducing relapses. So, Ocrevus, not bad, but there's better. So then I moved on to Kesimpta with the idea that if I took Kesimpta once a month, I'd have more regular dosing and I wouldn't get the crap gap, because that was my main complaint. What are the cons with Kesimpta? Well, finding a comfortable injection site, something that I think everybody has to get used to. I initially injected in my upper thigh, like they said on the brochures. It was very uncomfortable, but I did find place around my abdomen that there's a little bit of fat that I can inject into and I really don't feel it. So I'd say 9 times out of 10, it's very tolerable at this point. You get better at it. Initial dosing. So initially, you do 1 shot a week for 3 weeks, and then I think you skip a month and then you start doing your once a month thing. That first ramp up is a little much. You're getting used to a total lifestyle change where you're now responsible for these drugs and scheduling them yourself and doing all that stuff. And the side effects for me were really gnarly after the first few injections. 3 days after I do my injections, I'm just not a very nice person because I'm just very uncomfortable, but it fades quickly. And now, as of the last 2 or 3 months, it has not been bad at all. I'm very functional after my injection. However, Kesimpta in general just fatigues me a little bit more. I notice being responsible for the drug, well, they ship it right to your door, you put it in your refrigerator, and it stays there refrigerated until the day you take it. And, for some people, that's an $8, $9, $10,000 a month drug. Just having it there in the refrigerator, thinking that someone could accidentally leave it out or throw it away is, it definitely sits on my mind. But I have a special spot for it in the refrigerator and it's fine. Remembering to take it. I'm very OCD about my schedule stuff. It's not a problem for me. But for someone else that's not as OCD about their schedule, I think, you take something once a month, you better put it in Google Reminders because you're going to forget. The ramp-up side effects, I talked a little bit about that. My first 3 to 4 months, pretty rough for the first 3 to 4 days after the injections. And then my body kind of got used to it, I think. I don't know, but it's not nearly as bad anymore. It's very tolerable. The pros of Kesimpta. Well, home delivery, right? You're not scheduling clinic time, which is awesome. It literally takes 5 seconds to inject, which is awesome. You have the rest of your day. You're not committing your day to sitting in a clinic, though eating the cookies was kind of nice. Minimal side effects. I've had, and I put an asterisk next to that because I think it changes for everybody, but after the 4th or 5th month for me, I'd have to say the side effects are not bad. Not bad at all. No prophylactic cocktails. I don't need to take all those drugs like Benadryl and Zofran and all that stuff prior to doing the injection, which is really nice because I don't like taking that stuff. And so that's just one extra step I don't have to remember to do and something I don't have to be uncomfortable about. Even though I hate needles, I hate IVs, I hate all that stuff, it does get easier. It gets easier to give myself an injection every time. And now it's very easy. But the first time I did it, it took me an hour to convince myself. So Kesimpta wins out for convenience. And not only that, I think my MS feels a lot more manageable at this point, and I'm not experiencing any crap gaps. So that part's great. I hope you found this information helpful. Please comment below if you have any questions that I can answer. Again, I'm not a doctor, I'm not a clinician, I'm just a random dude on YouTube with MS that's a patient and also takes Kesimpta. Click that subscribe if you don't mind, and hit that like button if you enjoyed this stuff, because I want to make this channel a nice little community where we can share knowledge and experiences, not just around MS, but life in general. I appreciate you. I'm Cliff, and I have MS, and I'm out.